What do I do if my child's tooth gets knocked out?
So the most important thing is try and keep your child as calm as possible after the accident's happened, and double check that they don't have any other medical injuries that will require attention before we start looking at the teeth. So first of all then, let's double check that it is an adult tooth and not a baby tooth. It's important that we don't put baby teeth back into the mouth because it can cause damage to the adult teeth which are developing just underneath the gums. If possible, try and find the tooth and pick it up by the crown, which is the white part of the tooth, and avoid touching the root where you can. If the tooth looks visibly dirty, you can gently clean it under some running cold water for about 15 seconds. It would be fantastic if you can put the teeth back in, and either your child or you can do that if you feel confident enough to do so. Once the tooth is back in the mouth, get your child to bite down on a handkerchief or a piece of tissue whilst they're on the way to the dentist. If for whatever reason you don't feel comfortable putting the tooth back in, it's important that we have the right storage medium to keep the tooth nice and wet whilst we're going to the dentist to have it replaced. I'd recommend using milk or saline, but if that's not available, you can get your child to spit into a pot and the tooth can be transported in saliva. Or alternatively, if your child's old enough, we can put the tooth in between the molar and the cheek to keep it nice and safe on the way to the dentist.
How quickly do I need to get my child seen by a dentist after a mouth injury?
It's really important that you go to the dentist as soon as possible. A lot of dental injuries, the outcomes are significantly more favourable if we can start the treatment as soon as possible. It also reduces the number of complications in the long run and lengthy, more costly treatment, and makes your child a lot more comfortable. For example, if they fracture the tooth, we're able to put a white filling on immediately to stop any sensitivity to cold. We can often make your child feel a lot more comfortable. For example, if they fracture their tooth, we're able to put a white filling over the top to keep it nice and secure, and also reduce any sensitivity that they might be having to cold food or drinks.
Can a tooth be saved once knocked out?
We always try and save your tooth's own tooth when possible, because your child's natural tooth will always look the best. When you go to the dentist after the tooth's been knocked out and they've put the tooth back in, they'll make your child nice and comfortable and numb. They'll give the area a good clean, and then we use a special brace to keep the tooth in position for around 7 to 10 days. We'll also give you advice on what your child should be eating and drinking, as we recommend a soft diet, avoiding any contact sports, and then also keeping the area as clean as possible. All of these things will improve the prognosis of the tooth in the long run. We also carry out another investigations to check the nerve is healthy, so cold tests on the teeth and regular x-rays so that we can help diagnose any problems. And often we may need to carry out further treatments such as a root canal treatment to prevent the risk of any pain or infection.
What happens if the tooth cannot be saved?
It's not always possible to put the tooth back in, for example with very young immature teeth or teeth which are badly damaged. In that case, we've got loads of other options available for your child. Often we need to allow the soft tissues to heal, and we tend to use a little clip-in brace which has a false tooth attached to it. These work very well in young children and also children when they've got new teeth coming through. In the long run, when your child is reaching adulthood, we can also look at different, more permanent options, such as a sticky bridge, which is a false tooth attached to the tooth next door. They look fantastic, and they also have been shown in the evidence to last a number of years. The gold standard for replacement teeth is currently a dental implant, which is a screw which is attached to the bone, which is replaced with a white crown on the top. And again, they look fantastic and work really well.
Should my child wear a professionally made mouthguard for all sports?
So professionally made mouthguards are definitely recommended for any high contact sports or where you have moving objects. So for example, cricket, football or hockey, where the teeth are prone to fracture with these sports. Also in things like boxing and rugby, where you are more at risk of dislocations or fractures of the jaw. A custom-made mouthguard often fits the teeth a lot better, so they're more comfortable to wear.